Good morning, Royal Melbourne. We come up to you this morning with a approximately 47-year-old male. He presents with sudden onset of dyspnea at about midnight against the setting of a couple of weeks of general malaise.
What's the ETA?
15 to 20 minutes or so.
Cheers, we'll see you then.
So, 47-year-old, can't breathe. Sounds like 2 weeks of respiratory illness, and now he's really out of breath and really unwell. And the ambulance not sure what it is. Possibly pneumonia or a viral infection. Doesn't sound well though, so I need to find someone who can look after him.
Dr. Jonathan hands the case to trusted colleague, emergency Dr. Michael Dunn, who's been on the front line in ED for the past 8 years.
Jonathan's told me a gentleman in his 40s coming in is really struggling to breathe. His breath per minute is 50, but normal is about 12 to 15. That rate is not sustainable, so this guy could go downhill very quickly.
47-year-old Suryadi from Indonesia was staying at his son's house when he started struggling to breathe.
Are those sats what you've been getting the whole time?
They've been a little bit variable.
Hi, I'm Michael. I'll be looking after you today, all right? Ready, 2, 3, go. Okay, sit him up. Get some monitoring on, Mark. Be great.
With Suryadi in such distress, Dr. Michael immediately starts his examination.
It's very wheezy.
I can see from how hard he's working to breathe that he's really, really struggling. He only has probably about 10, 15 minutes before he starts to get weak and tired. So we need to fix the underlying problem as fast as we possibly can.
Can I get you to get pulse oximetry on for him? Let's actually quickly just get access and the gas and see where we're at. Okay. Can I get a truncated handover? Quick one?
Yeah, good one. So, 47-year-old gentleman lives at home, been in the country for 3 months or thereabouts,
Yeah.
doesn't speak English, from Indonesia.
Yeah.
He's been generally unwell with a bit of a cough, dry cough for the last 2 or 3 weeks.
Yeah.
Last night about midnight, felt sudden onset of dyspnea,
Yeah.
and that's progressed throughout the night. His daughter found him this morning looking like he is now, called the ambulance.
All right, thank you. Okay, let's treat it as a non-infective exacerbation of COPD. We'll get access, give 8 milligrams of Dex.
This potentially could be COPD, which is similar to asthma, makes it really hard to breathe. So I'm going to give steroids, we'll put on a special mask until we can get some further tests back to confirm what we think is going on.
Hi, can I get portable X-ray and resus too? I'll put a request through in a second. Yeah, please, yeah, thanks.
Hey, I'm so sorry. Very tight, but still help me breathe, okay?
Suryadi needs urgent help to breathe. The team hook him up to an oxygen supply as blood tests and X-rays are fast-tracked.
X-rays, ready.
He's got pneumonia there, isn't he? On the right side.
When I see the X-ray, the first thing I'm thinking is this looks like pneumonia. And it might be driving all this, or it could just be another symptom of a more sinister process.
Is he febrile with us?
37.2.
37.2. So we'll bring down the pressure support a bit. That's a bit too high, probably.
Dr. Michael is waiting for the blood results to help him understand what's going on.
Michael, I've got a pH of 6.9, hemoglobin of 76, I think. Temp 21.
Jesus. 21.
One of the blood tests we get back is a lactate, which is really a marker of how sick you are. Normally it's 1, maybe 2, and Suryadi's level's 21. He is minutes to hours away from death. We really need to figure out what's going on. There's a good chance Suryadi's going to die today.
For the last 7 years, emergency registrar Dr. Ilya Kadalski has ridden the same path from his home to the Royal Melbourne Emergency Department.
My ride to work is on a nice bike path most of the way. There are a tram line that makes you break out in a cold sweat occasionally, but it's mostly a really invigorating way to start the day, and I arrive to work energized for a busy day.
Ready, set, go. Well done.
First through the doors this morning for Dr. Ilya is a woman who is in severe pain after falling at work.
And where's your pain at the moment?
Paramedics have given her the green whistle for her pain.
Back of the neck? And lower back.
38-year-old Sarah, an admin worker at a fruit market, spent 10 terrifying minutes on the floor, not moving, waiting for help to arrive.
down.
Just relax your shoulders. We don't want you to move at all, okay? Especially because you've got the spine pain.
This is Sarah. On the way to work, she was walking in and there was a puddle on the floor and she has slipped. Since she's fallen, she's had considerable C-spine tenderness with no movement of her neck at all, with a left-sided altered sensation, pain and tingling down her left side.
Good morning, Sarah. My name's Ilya. I'm one of the emergency doctors. Where are you sore at the moment?
Just right in the middle of my spine, to the left side as well, and just one lower back.
Have you got a neck ache?
My neck is very sore.
Sarah has experienced this pain before.
So I had spinal surgery a year ago. Just a lot of pain and I won't have to operate again.
You're going to be okay. We're going to check everything for you, all right?
Yeah, I just don't want to have to go through it again. That's all.
Sarah's had a very long history with pain in her neck and spine. She's had 2 spinal operations and she's gone through a long and hard process of recovering. To have to face that again would be very daunting. Let's get you some more painkillers.
Sarah was just starting work this morning when the accident happened.
Did you hit your head on the way down or on the floor? Or?
It was more my shoulder, trying to brace myself.
Oh, okay. You mostly landed on the shoulder.
The neck and the shoulder, yeah.
Do you feel me touch you on these sides?
Yeah.
Dr. Ilya is looking for any loss of sensation that would indicate nerve damage.
Feel me touch you here?
Yeah.
What about on the inside of your arm here? Do you feel that?
Are you touching me now?
Yeah. You don't feel this at all?
No.
Do you feel this? It's okay. We've got some slightly altered sensation C8 and T1 on the left side. She doesn't feel it also. Just try a bit of pinprick. Sarah can't feel the areas of her body that I'm touching, so I'm getting a pinprick to check for sharp sensation. Do you feel a sharp stabbing here?
No, are you touching?
Yeah. Do you feel a sharp stabbing here?
For Sarah, who is still recovering from major spinal surgery last year, this fall could have life-changing consequences.
What about there? Feel a sharp stabbing there? It's okay. That's okay. We need to have a look at your back as well, okay?
Yeah.
So we're going to roll you over to the side like a log.
I'm just going to hold your head nice and still. Okay.
Yep.
You look cold.
I'm freezing.
Yeah, you get a warm blanket. Okay. Take a deep breath. All right, on my count, 1, 2, 3. Oh, here you go.
Do you feel me pressing up here?
Yeah.
Is that sore?
Yep.
Is this sore?
Yep.
As I'm examining Sarah's spine, I'm noticing that she's in quite severe distress, so potentially there could be injury at any of the areas that are painful, and a lot of it is painful. And what's really bad?
Like right up in my neck.
Right up at the top.
Yep.
Sarah's mother, Jan, has rushed in to be with her daughter, anxious that Sarah may be facing another traumatic injury.
It's been a horrible year, and then with this, it's going to set her right back, which is the worst thing that can happen right now. I feel like my heart's going to come out my throat.
Okay, on my count, 1, 2, 3. There you are.
So you're doing great. The whole thing's quite tender.
Yeah.
But we'll do some scans of your neck, especially with that metal work in there to make sure it hasn't shifted.
Yeah.
I think the most important thing now is just to make sure there's no cracks. Because Sarah's had previous operations to the spine with metal pins and rods that fix the bones in your spine together, we'll be looking to see if any of the metalware has shifted. They could bend from a stress of a fall, or the bones around the metal could break.
Just stay nice and still.
Emergency nurse Eliza Berg tries to comfort Sarah.
Not a good start to the week.
No. Not a good Monday morning.
No. Sarah has a previous neck injury and has spent a long time in a hard neck collar, so we're on high alert for a neck injury. So we need to keep her very still and put the collar on. Today is just like a bad dream for her, really, that it might all happen again. Okay, so that one's pretty snug. You've probably worn this before. Yeah. We'll keep that on till you have a scan.
Sarah's previous accident was very similar to what happened this morning.
I was actually in Bali. I was having like my morning shower and I slipped and I went straight into the concrete wall. I had to get an emergency flight home. It was a millimetre away from becoming a paraplegic, and it's pretty scary.
She now faces the devastating possibility that the CT scan will show another serious neck injury.
How you going, Sarah?
Ready to go? Pain? Sore?
Dr. Michael is ultrasounding 47-year-old Suryati, desperately trying to figure out what's causing him to be so unwell.
We still don't have a clear reason as to what's driving all this. Potentially could be a very severe infection and it's affecting his lungs, his heart, but the bits of the jigsaw aren't really fitting together.
Dr. Michael tries to rule out a potentially life-threatening condition.
I'm gonna try and get a view of his tummy just to make sure he's not having a AAA. I don't think he is. It doesn't make sense as to why he'd be in respiratory distress if that was the case.
The ultrasound I'm doing can tell us if there's a burst blood vessel in his tummy. It doesn't explain all symptoms, but it's one of the things I want to look at that cause you to be that unwell that quickly.
I think his aorta there is very small. No, his aorta is tiny.
Dr. Michael is still no closer to knowing why Suryati is so sick.
So he's had DEX, he's had salbutamol, ipratropium. I need to get a story as to what's going on.
We're slowly working through the potential life-threatening illnesses that can cause him to be as sick as he is. But I need more information in the next hour or he's going to deteriorate even further. So we don't have the luxury of time. We need to figure out what's happening and we need to know now.
Do pain? Pain, no?
Dr. Michael urgently needs some answers. He asks family friend Irvin to get Suryati's son on the phone.
Hello.
Hi, how are you? I'm Michael, one of the doctors here in Royal Melbourne. I'm with your dad.
Okay.
He's quite sick at the moment. I was just wondering, has he been unwell in the last few days?
Yeah, he's been unwell since last week, but it's just like coughing and fever.
And before that, he was well. Is that right? So 2 weeks.
He was well.
Are you coming in to hospital?
Yes, I'm picking up my mum right now. I'm now get to hospital probably like in half an hour.
Okay, perfect. I'll see you when you get here, okay?
I'll see you.
Thank you.
Thank you.
Thanks. Bye.
We're no closer really at this point to figuring out what's going on. So it's really about keeping him from getting worse until we have answers. He is easily one of the sickest patients I've seen and by far the sickest patient in the ED at this point in time.
So it's really important you keep very still. Just don't want you moving at all.
Emergency nurse Marcus Christie is waiting for 38-year-old Sarah to finish having her neck and spine scanned after she slipped on a puddle and fell down at work.
She does have altered sensation to her body. She's just not feeling things like we would like someone to. Worst case scenario is any sort of paraplegia, neck injury, spinal injuries.
How you going, Sarah?
Sarah's life was turned upside down a year ago after a terrible fall in Bali where she slipped and fell in the shower.
It's just hard to do everyday things, you know. The lasting pain is very draining. I got my fiancé, Alex, and we were actually supposed to get married last year, but we've put that on hold.
Dr. Ilya now has the CT scan results.
So you can see all the vertebrae running down, and over here there's been some metal work that's showing up really bright and white and some screws holding these bones together. I don't see any cracks in the bones. I don't see any bend in the metal. I don't see any shifts, and looking at sort of the columns of the spine, everything looks like it's lining up okay. That's great news.
Dr. Ilya can finally reassure Sarah.
The scans look great. There's no broken bones. All the metalware and bits and pieces all look perfectly aligned. So I haven't done any damage there. What about the sensation and the strength and all that?
Yeah, I just feel a little bit weak on the left side.
Sarah's feeling is coming back.
But everything's looking pretty good so far and you're making good progress. I don't think there's any serious damage.
I'm really happy to hear that.
So Sarah needs time in hospital because she is in a lot of pain, and we do have to get some MRI scans done to see if there's any injury to the soft tissues or to the nerves. The MRI scan will also show if there's injury to the ligaments, which might need a supportive collar to let those heal a bit, but won't result in requiring surgery.
Sarah's mother finally gets to comfort her daughter.
How are you feeling, really?
So?
Relieved that Sarah's scans are clear.
Try and move your legs, put your knee, give your knees a bit of a wiggle.
Yeah.
Makes everything better for you.
Mum will be cleaning the house for the next few weeks, I reckon.
That's what mums are for, not.
I think she's going to be okay. We just need to get the pain specialists involved in her care. There is a tough road ahead. It's going to be a long journey, but I think we'll be able to support her through that.
You gonna come run with me next year?
I do need to get back into it, so
Yeah.
you just keep on motivating me to do so, and I reckon I'll join you.
Emergency Dr. Michelle Thornhill is on a recruitment drive and has emergency Dr. Bjorn Macon in her sights.
You don't have to try to break any records, just, you know.
I'm an insanely competitive person, you know.
Definitely on a mission to get as many people as I can to join me in my running quest for fitness. Running is a really good way to build up your endurance, to power through even when it gets tough.
And Dr. Michelle's day is about to get very busy with her first trauma case on the way.
It's a young boy coming from a motorbike, jump and fall on the jump. Sounds like pain might be an issue.
The team is expecting an air ambulance carrying a young motorbike rider who's had a terrible crash.
They've probably been giving fentanyl. We can give some more if needed. We have a young man coming in who's come off his dirt bike. This really sets alarm bells off because these dirt bike incidents can be, quite catastrophic. So we just need to be really vigilant for some severe injuries. All right, helicopter is on the roof.
The patient is 16-year-old Connor, who was taking a jump on his dirt bike at a motocross track when the accident happened.
Right, he's here. Hello, guys, welcome.
So this is Connor.
Hi, Connor. I'm Michelle, one of the emergency doctors. We'll just get you over to the bed, and the ambulance guys are going to tell us the story.
Okay.
Before Connor can even be moved onto the ED bed, the team must get his pain under control.
I'm just going to give it a little bit more.
So your shoulder's sore?
Yep. All right, 1, 2, 3. Okay.
You're doing great.
You're doing well, mate. All right, we're going to come across on 3.
Yep.
1, 2, 3.
You got this, okay? Can you help me with that blood pressure? Just worried about his shoulder. Sorry, mate.
So this is Connor. Today he was riding motorbike approximately 60 kilometres an hour, has gone over a jump and he's lost control and he's fallen basically upside down and he's hit the bike and then gone into a puddle of water and he was in that for about an hour before he was removed. Part of medical history is shoulder dislocations.
Connor has had shoulder problems for the last few years.
It actually occurred this morning whilst he was riding the motorbike at the motorbike track. After 5 minutes, that relocated and he continued riding. He says that would have been his 8th time in its history that it's been dislocated. His right shoulder and his right entire arm's quite painful.
I'm really surprised to learn he possibly dislocated his shoulder, put it back in, and kept riding. Connor's complaining of a lot of pain at the moment. There's a possibility that his shoulder is again dislocated. We need to see if there's any fractures and if there's any potential injury to his spine as well.
Back-wise, he's got lumbar discomfort and some pelvic discomfort as well.
All right, does that shoulder look swollen at all?
I dislocate my shoulder.
No. All the time.
Any surgeries on the shoulder? No, okay. Any other surgeries otherwise?
I would expect pain if he's dislocated his shoulder and relocated it, but I wouldn't expect him to be in this much pain. So I'm concerned that there is something more going on. If you come down hard onto the ground, you can break any number of bones. He might have done injury to his spine that could be life-altering.
Yeah, he's completing a pain there.
Little injection, okay? Little injection.
Dr. Michael is trying to save 47-year-old Suryadi, who's gravely ill and struggling to breathe.
I think we just assume it's respiratory sepsis.
Dr. Jonathan is helping search for answers.
What do you reckon's going on?
I think he's got really bad sepsis and he's possibly gone into a high output cardiac failure.
Yeah, okay.
That's my working diagnosis at the moment. His lactate's 21 though.
Having colleagues to bounce ideas off as to why someone's so sick is very valuable.
It's not myocarditis or something. It's not like
His heart's moving too good.
Yeah.
His echo looks fine.
What about primary lactic acidosis? And it's all just metabolic, like leukemia.
Yeah.
You're okay.
Looks terrible.
With Suryadi deteriorating rapidly, more detailed blood results are phoned through.
Great, thank you for that. Appreciate it. Cheers. His white cell is 77 apparently.
No.
Yeah.
What's going on?
It's got me leukemia.
Yeah.
Normally, you'd have white cell count 4 to 8. If you're sick, it might be 12, 15, and his are 77. So that's really pointing towards leukemia or lymphoma or some sort of blood cancer. I don't know, will he survive the next 24 hours to get the treatment he needs to treat this?
I've requested units of blood. We need to get them down. There's some additional blood tests that need to be sent off before we do that. Yeah. The immediate plan is to give red blood cells.
As the team prepare to give blood, Suryadi's wife, Novalita, and his son, Rafa, have made it to the hospital.
Hello. Hi, Michael. Nice to meet you. He's very, very sick. His white cells, which is the cells in the body that fight infection, are very, very high. Higher than we'd ever expect them to be. And we're doing some additional tests to figure out why that might be, and is there a problem with his blood that's causing him to be this unwell?
Normally, when someone's very sick, I like to be able to take my time with the family, but given how sick Suryadi is, I don't have the luxury of time, and nor do the family. So I want to let them know he may have very limited time left.
We'll have more answers soon, but at the moment, he's very, very sick. Probably one of the sickest people in the hospital at the moment.
The team know that Suryadi won't survive much longer without intervention.
I think he's going to end up being tubed.
He's going to tire out, isn't he?
He's going to tire, yeah.
They urgently need to put him to sleep and take over his breathing.
Give me a yell if you want help. Yeah.
The worry with intubating is that when you stop someone breathing, even for the minute to put the tube in, that's a very high risk time where their heart can give out. I don't know if when we put the tube in and put him to sleep that he'll ever wake up again.
Have you said goodbye to him, spoken to him? Okay. The hematologist will take you to a quieter room. Just rest assured he's been looked after very well, okay?
They urgently need to put in a breathing tube to keep him alive.
So I'm going to drop the bicarb in, then I'm going to drop the drugs in.
For such a risky procedure, Dr. Jonathan steps in to assist.
Then we're going to lay him flat,
Yeah.
right? You're going to tube, and then we're going to just hyperventilate and try and match the breathing.
This is not an easy intubation. So many things can go wrong here. He may be building up blood in the lungs. That means we have less time to get the tube in before you get irreversible damage to your body.
The other thing is he is at high risk of just arresting after induction.
Yeah.
Can you draw me up some 1 milligrams of adrenaline?
Yeah.
Make no mistake, Suryadi is at a high chance of having a cardiac arrest whilst we do this intubation. Despite all our good planning, it may still happen. So we have to be ready for it.
Can't breathe? Yeah. It'll be all right. We're going to make you breathe very soon. All right. Looking good?
Yep.
Ready to go?
Yep.
Let's do it. We're just going to drift you off to sleep now. That's 100 of ketamine.
Yep.
That's 100 of rockuronium. Let's flatten. Let's go back. All right. Let's go, Thomas. 1, 2, 3. Right, let's put pillow under head.
Yeah.
Can you do it from there, Michael?
Jonathan's role is to give the drugs that put Suriati asleep, but also keep an eye on his blood pressure and heart rate and oxygen levels, where my role is to get the tube in and get it in as quickly as possible.
That's 30 seconds post-rock.
Keep breathing, keep breathing, keep breathing.
45 seconds.
Someone's as sick as Suriati, you have no time. I have less than a minute to get that tube in, or things will go south.
Nice and fast, keep going. Boom, 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 boom. Ventilate, ventilate, ventilate.
And that's a minute post-rock.
Okay, go.
Let's go.
Suction.
No. How's that?
Yep. Bougie in.
All right, bougie through the hole. Beautiful. You're in the spot. It's all looking good, Michael.
Yeah.
Airway is good, so I'll call for a chest X-ray.
Yeah, please, yeah.
But it sounds like the tube's in the right spot. He's really critically unwell, this guy, but it's touch and go. He could still arrest any moment. We're doing everything we can to stop that, obviously.
With Suriati now on a breathing machine, but still dangerously unstable, Dr. Michael keeps a close eye as they prepare to move him to ICU.
When Suriati hits ICU, they will continue to monitor his blood pressure, his breathing, and as soon as possible, commence him on some form of chemotherapy to try and treat the cancer we think he has.
I'm happy to go if you guys are happy to sort of help us get to the lift.
Yep. Even though we've done everything we possibly can in ED, I still feel a little bit disheartened because there's a high probability he's not going to survive this. Only time will tell, but hopefully he pulls through.
Well, you're on your motorbike, is that right, on a dirt track?
I go up this jump and I'm going too far from the jump and I lost control.
16-year-old motocross rider Connor is in a lot of pain after crashing his bike, landing heavily on the ground.
You're right. I want you to focus on me, okay?
Experienced emergency nurse Emily Morris tries to distract Connor from his pain.
I'm going to talk to you about your mullet because it's one of the most beautiful things I've seen in a long time.
I hate it.
You hate it?
It's not the haircut, it's not the thing that
They're just going to go over it?
it's the top. The top's ranger.
The top. It's Ranger.
Ranger.
I think it's dirty blonde.
When I'm talking with Connor, I want to be able to create some sort of connection with him. I want him to be able to know that in this room full of people, that there's somebody there that sees him and has his back.
Put some frosted tips in it.
This is a young man who's had a really, really scary experience that is isolated in this moment and is feeling really scared.
What I'm going to do now, I've got to work out exactly where you're most sore. Sore on that bone there?
Oh, you're there.
Connor, was like your parents there?
That was there.
Oh.
Dad Paul knows how much his son loves motocross.
Connor's a very energetic kid with a strong personality. He pestered me for a long time to get a motorbike, and eventually I caved in. And whenever Connor's on the bike, I am worried because I know he's going to take risks and push himself to the limit. When you reach your limits, that's when things go wrong.
Connor, we're going to need to look at your back.
Given that Connor landed hard on the ground, the team prepared to check his spine.
You think that you can bend your elbow and put your arm on your stomach? Do you reckon you can do it? We're going to do it together.
We want sort of both arms.
Oh, that was hilarious.
There we go. There we go. There.
Even the simple act of moving his arm is incredibly painful.
On 3, 1, 2, 3.
Good job, mate. Connor, is there any pain where I'm pressing there, yes or no?
Yes.
There is, yep.
I'm behind my right shoulder blade. So
Yep, on that side, yep. Is there pain in the middle there?
a little bit.
Yep.
Connor's pain needs further investigation. So Dr. Michelle explains next steps.
We're gonna get you around to the CT scan,
What's
okay? It's like the X-rays, but it gives more detail of all the bones and the organs inside. And they'll move.
The one where you go inside of it.
It's a big donut, a ring that you pass through.
It's really important we get scans done quickly for Connor to see if there are any fractures or other injuries so we can try to determine what's causing all this pain for him.
Let's just spiral off.
your right arm.
That's sucking. I'm really worried.
Yeah. Okay, so we're going to take you around for a CT scan now.
Yeah.
All right.
Nurse Emily is staying by 16-year-old Connor's side as he heads for a CT scan after he crashed his dirt bike on a jump.
The pain's coming back? Yeah. We'll get you some more pain relief.
My name's Annie. I'm going to do your CT scan. Got to keep your head nice and still, okay?
He's sore. I think he's a bit scared.
Dr. Michelle is waiting anxiously to see Connor's CT results as they come through.
Connor's main issue is his shoulder pain. Worst case scenario, Connor has major injury to that shoulder with inability to ride his motorbike again. Lucky for him, nothing's dislocated, and it doesn't look like anything is fractured either. I am a bit surprised that there's nothing obviously wrong. I think Connor's pain is mainly due to what we call soft tissue injury, which can heal 100%. We do say that young people tend to bounce, so maybe, this was his lucky strike.
Hello.
Connor's dad, Paul, arrives after a 2-hour drive from country Victoria.
Hi, mate. I made it.
Dr. Michelle now has the news Connor's been waiting to hear.
Hi, Connor, I'm back. I have some very good news for you.
No broken bones.
No broken bones that I could see. The reports on your arms, I can't see anything.
The parts I was wearing.
Exactly. Connor goes 5 meters up in the air and falls flat on his back into a puddle. And amazingly, he's come out relatively unscathed. It is somewhat of a miracle. Just relax for a second. Next for Connor is he gets admitted to the hospital. He might stay a couple days, but I don't think it'll be too long. Probably no work or play for a bit either.
Despite Dr. Michelle's advice, Connor has only one thing on his mind.
Don't tell the hospital, but I reckon I'll be back on the bike on Tuesday. So, it'll be good.
The Rolling Stones were never your generation, right?
No.
So why are you so interested in seeing them? They're now 80 years of
I want to
age.
see them. I just think their new album is really good.
In between cases, emergency Dr. Glenn Harrison has a chance to catch up with colleagues.
This is good with Lady Gaga in it.
Nah, they're too old. I listen to lots of Aussie bands. I've dabbled with piano myself, but self-taught and very bad. Their new song's called Change My Catheter and Geriatric.
Room Melbourne receiving.
Dr. Glenn's playlist is interrupted by a trauma call.
This is the Micro 8 crew coming to you with a 25-year-old female. Tennille presents tonight in an SVT since 12:50 this afternoon. She currently sits at a rate of 198. We're about 15 minutes off.
Room Melbourne received Micro 8. We'll see you in 15 minutes. She's pretty sick, this one.
They're saying SVT.
She's got a heart rate of 198.
Where are they going to go?
Trauma 1.
Okay. Ambulance call is a 25-year-old female who's coming with a very fast heart rate, 198 beats per minute. Lowish blood pressure with that. She's still in a very fast heart rate. She'll be here in about 5 minutes. SVT is a rhythm disturbance of the heart. Having a fast heart rate can be dangerous because it's like you're running a very fast race all the time. It makes patients feel extremely unwell. Amy, can you just make sure to put the pads on for her? Worst case scenario is that she develops heart failure. The defibrillation pads allows us to give electric shock to reset the heart.
Busy new mum Tennille's heart rate had been high for hours before she finally called an ambulance.
So what's the most recent?
Heart rate's about 200.
Sure, okay.
Last time I saw you about 2 weeks ago.
Yeah.
That's true.
Only went home 2 days ago.
Tennille is only in the hospital a couple of days ago with a similar issue. It is concerning that she's come back into the hospital with a very fast heart rate again. All right, who's handing over?
Yeah.
Go for it.
Tennille's a 25
28-year-old female, around 12:50 this afternoon, running across the road, onset of palpitations. Has sat on it during the day as she's got a little bit going on at home, but obviously as it's progressed throughout the day, it's called AB this evening, where she's presented initially with a heart rate of 200 in an SVT. Initially, we've managed her with the adenosine. She has brief periods of reversion, and then goes straight back into the underlying arrhythmia. She has a significant cardiac history with congenital issues. She had valves repaired and replaced, so there's a bit going on.
Thank you.
Thank you.
All right, we'll see how we go. Cheers. Tennille's had a bit of a torrid time. She's only young. She's got congenital heart disease and had surgical repair for that when she was a lot younger. And in a complex cardiac patient, you certainly want to think about the things that will work quickly for us and safely. Hello, Tennille. I'm Glenn, one of the doctors. How are you going?
Awesome.
You're looking pretty good, but your numbers say something different. All right. How many times have you had this, do you think, in total?
This will be my sixth time.
Okay, all right.
Worryingly for Tennille, who has suffered heart conditions since she was a young child, this is a new complication.
I had my first episode 2 months ago, and then it's just been nearly every week afterwards. It's just like a jackhammer.
You're going at 220 last time. You're only 200 this time?
It got up to 240 in the end.
Did it?
Yeah.
Do you feel nauseous?
Yeah.
Okay, we might get you something for that. Let's just do 4 of ondansetron. How do you feel when you have the adenosine? The medication we're going to think about giving is the adenosine. It temporarily stops the pacemaker function of the heart, so it stops the conducting between the chambers of the heart, so it sort of resets.
I feel it's 12.
Yeah.
But I get nauseous.
Okay, all right. Because I'm probably going to look to give you 18. So just ask you to have some, deep breaths through it. It doesn't last too long overall. The next step for her is actually to give her, a higher dose of that same medicine. This medicine is going to make you feel pretty terrible. Chest heaviness, shortness of breath, or just feeling anxious and sweaty. It's actually quite uncomfortable for patients.
Dr. Glenn waits for Tennille's nausea to settle before he can give her the drugs to slow down her super fast heart rate.
So, who do you live with?
My partner and my baby.
They know you're here?
Yep.
Okay.
They were at home when I got home.
Okay, all right. What we might do is when we give you the adenosine...
Lay down.
Yeah. You've been through it lots of times.
Knowing she might be in the ED for a while, Tennille has come prepared.
Lucky you bought your Lion King backpack in.
Yeah, I brought sausages in too.
Oh.
I made me partner quickly cook them before the Emma.
Well, if this all works, we'll celebrate with a sausage.
Oh yeah, will be.
How's your nausea at the moment? Better?
Yeah.
Almost. All right, should we give it a go? I'll lay you down, okay?
Dr. Glenn prepares to give Tennille the medicine to reset her heart.
The risk is the heart does respond to it but doesn't restart. That's a cardiac arrest, and that means that we would have to do CPR and the shock with the machine and the cardiac pads. You ready?
As ready as you are.
Okay, it's in. You'll be feeling it soon. Just take some deep breaths, big, slow, deep breaths. We'd expect that medication to be into the vascular compartment, getting to the heart really, really quickly. She'll have some symptoms of feeling a little bit uncomfortable, usually within 15 or 20 seconds.
Yep, feeling it.
Yep, nice deep breaths, well done. Sounds like it's getting faster, doesn't it? No. Slow deep breaths for me, slow deep breaths. That sensation that people get with that medication, it can be quite distressing, can make people quite anxious, and that will actually put their heart rate up a little bit. How are you feeling? You're a bit flushed? It's always a difficult time frame between giving the medication, watching the patient and hoping that that heart resets.
Finally, Tennille's heart is slowing.
And I don't feel it anymore, so...
Okay.
Definitely work.
We'll switch up a little bit in the next minute or so, okay? Make sure your blood pressure's all right. All right? Good on you, well done.
Thank you.
I'm very happy that Tennille has responded to the medication. She's been very stoic. She probably needs to stay in hospital for observation. Monitoring her heart to make sure it does stay in a normal rhythm is really important for her. She's got some complex cardiac problems.
Tennille is relieved the higher dose of medication has worked.
I don't even know how to describe the feeling. It's like going down a roller coaster. Worst feeling you'll probably ever have in your life, but it's worth it in the end. The nurses and the doctors, they've saved my life plenty of times. There you go. How amazing is that, guys? That's what you call service.
She can now have the treat she's been waiting for.
Thank you for heating them up, by the way.
You're welcome.
Muchly appreciated.
Tennille's partner, Patrick, is keen for a review.
They good snacks?
Yeah, thanks for making them. 10 out of 10.
Tennille will stay in ED for observation and then move up to the ward. 16-year-old Connor arrived to ED after crashing his dirt bike on a jump.
Yeah, he's completing a pain there.
I'm really surprised to learn he dislocated his shoulder, put it back in and kept riding.
Connor, is there any pain where I'm pressing there, yes or no?
Yes.
Luckily, CT scans revealed that Connor had no broken bones, but did need to rest his shoulder and stay off his bike.
Probably no work or play for a bit.
After a night in hospital, Connor was allowed to go home, but he had no intention of slowing down.
The day after I got out of hospital, I spent recovering in bed, and the day after we went to our holiday house and I was jumping off bridges and wakeboarding and riding bikes.
How's that, mate?
Yeah, I just need to go down a little bit.
Awesome.
Connor knows exactly what his future holds.
100% I'm going to keep riding competitively. It's been my passion for a few years now and I love it more than anything. It's the best feeling ever.
And is prepared for the risks.
I'm not worried about having another accident because I know that comes with the sport. I don't know any great riders that haven't had pretty bad crashes in their lives, so I know that it's going to come again. I was told I'm lucky to not be in a wheelchair, paralysed, so I feel pretty lucky.
Admin worker Sarah was rushed to hospital after she slipped and fell at work.
And where's your pain at the moment?
And my lower back.
Sarah was terrified she may have re-injured herself after a similar fall last year.
I was actually in Bali and I slipped and I went straight into the concrete wall. It was a millimetre away from becoming a paraplegic.
After extensive scans to check her neck and spine, Dr. Ilya was able to give Sarah the good news.
The scans look great. There's no broken bones.
3 days later, Sarah's feeling much better and excited to be heading home.
The first thing I'm going to do is hug my cat and then probably kiss my fiancé. Should probably do it the other way around, shouldn't I?
An MRI showed torn ligaments, so Sarah will have to wear a neck brace for the next 6 weeks.
Been through worse and I'll get through it.
All right, you look after yourself. That's okay. Take care.
Appreciate it. The staff here are amazing. Royal Melbourne Hospital. Couldn't have done it without you.
Thank you.
What's your readings?
I spent 200.
It's just like a jackhammer.
New mum Tennille arrived back into hospital with a racing heart.
Last time I saw you about 2 weeks ago?
Yeah.
That's true.
Only went home 2 days ago.
Dr. Glenn worried she could go into heart failure.
Amy, can you just make sure to put the pads on for her?
Tennille was given a powerful medicine that successfully reset her heart to a normal rate.
Yep, good on you, well done.
Tennille was kept in overnight and went home the next day with plans to see the cardiology team for further investigation. 47-year-old Suriati arrived in ED struggling to breathe.
Pain? Sore?
Dr. Michael feared he would not be able to save him.
Lactate 21.
Jesus.
Blood tests revealed he could have leukemia and was only hours away from dying.
He is easily one of the sickest patients I've seen, and by far the sickest patient in the ED at this point in time.
It's now been 3 months since Suriati's shocking diagnosis, but his son Rafa can't forget that day.
It was so scary to me because the doctors told me your dad might not survive in the next couple of hours. It's very confronting to me and to my mom. Halo, Ma.
Ya?
Udah bisa jalan-jalan dong sekarang?
Ya, bisa. Aktivitas sedikit-sedikit, tapi belum sepenuhnya.
Suryadi is now back in Indonesia after spending 5 days in ICU before moving to a cancer centre for chemotherapy treatment.
After a few days, he made recovery and he's now on ongoing treatment to treat his cancer.
Suryadi is now enjoying each day and getting stronger.
I try to call my mum every day to check on everything, how that's going. He can do more things himself, going back to the garden, doing his farming. I'm now very relieved that my dad is going to be well. It was very remarkable the way Royal Melbourne Hospital Emergency Department taking care of my dad. It's like a miracle.